If you give in to defeat at every turn and continue to wallow in depression and fear, this becomes a self-fulfilling prophecy, and you continue to set yourself up to be defeated. Therefore, it will happen. Whatever you set yourself up for happens. However you choose for your life to go, it will go that way. Notice that there are a lot of little steps in between the bigger brushstrokes of attitude and belief changes. We have to consciously decide to get better, and we have to begin to fill our mind with the expectation that things will start to get better for us. Since this is such a hard and foreign notion to us at first, after all, it's difficult to believe things can get better for us after all we've been through. We want to use the statements that we've used on prior tapes to keep reinforcing the good, rational, and true beliefs that we are learning and repeating to ourselves. It makes a very big difference how you view yourself and your world. But your view can't automatically change all in one day. It will take some time. It always does. But as you keep dropping these positive, rational statements and beliefs into your mind, the more and more you will be able to believe and accept the truth. Physiologically, as you start to get better, you are building a new neural pathway in your brain. In the past, your brain chemistry sent messages down your old anxiety neural pathway, which led to feelings of anxiety, frustration, anger, fear, and depression. The cognitive therapy you have been doing, however, is creating a new neural pathway, so that your brain can literally be reprogrammed to think differently and feel differently. But right at this very moment, your brain has both neural pathways, both the old anxiety-ridden pathway and the new rational thinking pathway. Whatever methods, techniques, and statements you have been getting down into your brain are becoming permanent, and they are forming a new brain pathway, quite literally, inside your mind at this very moment. It is important for you to know that both brain networks exist inside your mind at this time. You have two competing pathways in your brain at present, and this explains, to some extent, why our progress is never linear, why it's always 2 steps up, 1 step back, and why we have setbacks from time to time. Your next handout is called Setbacks, Two Competing Neural Pathways in Your Brain. Follow along with me as I read it. Remember, it is important to get this therapeutic information into your mind as many ways as you possibly can. That is why I am talking it to you, as well as having you read it to yourself. After this tape is over, of course, you want to read it out loud to yourself using slow talk. The more ways we can get this therapeutic information, these accurate beliefs, into the brain, the better and quicker your progress will occur. Two competing neural pathways in your brain. Setbacks happen to everyone as they recover from an anxiety disorder. Unfortunately, I have never worked with anyone who didn't experience many setbacks on the road to full recovery. It happened to me, too. But please remember this. You can't have a setback unless you've already made some progress. Let's put this in both physiological and neurological terms. Your old neural pathways, the millions of nerve cells in the brain that transmit messages, thoughts, and emotions, automatically lead you toward your old responses, anxiety, fear, and the related depression. This old pathway is tangible. It is real. It has now been mapped out in the brain by the very new brain scans. Since your old neural pathway was used for many, many years, it is normal that the thoughts and beliefs that traveled along these pathways became ingrained, became habits, and became automatic. However, when you began therapy, you also began to develop a new neural pathway. You learned new ideas and new concepts. You read things that were hard to believe, but were rational and positive. As a result, literally, millions of brain cells began carrying the new messages you were learning, the methods, strategies, techniques, statements, and concepts of overcoming social anxiety. Your new neural pathway was being created. The more you practiced and sunk the information down into your brain, the stronger you made this literal neural pathway. The more you continue to use these new methods you are learning, the stronger your new neural pathway will become. The more you use the new, and the less you use the old, you are literally changing the way your brain responds, automatically and habitually. That is how we get over anxiety disorders. Your brain starts automatically using the new pathways. The brain operates in much the same way as the rest of the body. It operates under the use it or lose it principle. If you use your new positive pathway, it grows stronger. If you ignore and do not use the old anxiety pathway, it grows smaller. So to some extent, we want to use what we know is best for us to continue growing our new neural pathway. And we want to avoid and stay away from the triggers that lead us down the old pathway. But right now, you have two competing neural systems in your brain concerning anxiety situations. The old neural pathway is not entirely gone yet, so there is always the possibility that we might experience a setback. The worst kind of setback from your perspective is after you've felt good for a few days or a few weeks, and the anxiety has been deflated and seems to be somewhat under control. Naturally, you think you've got anxiety pretty much licked. Then, out of the clear blue sky, and without warning, boom, the anxiety floods back in pretty strongly, and you are left feeling defeated, deflated, and questioning your progress. What is actually happening, though, is that through some old association or remembrance, your old neural pathway got stimulated, and the old consequence happened. You had anxiety. But this time it occurred when you may not have been expecting it, which makes it worse, of course. Now this is very important. Let's look at the reality here. What is really going on? This setback is actually a sign of progress. It is a good experience in the long run, not a bad one. It is important that you begin to view it in this way. Your old neural pathway somehow got stimulated or triggered, and your new neural pathway did not have enough time or strength to respond. That is perfectly normal. It is a part of recovering from an anxiety disorder. Now, as you begin to view it in this rational way, you start to respond by using your new thoughts, strategies, and methods. You must call anxiety's bluff. What really happened was a last-ditch attempt at pulling you back into anxiety land, to get you to believe that you're totally hopeless, that the therapy doesn't work for you, and that things will just stay bad forever. But since you are developing that new neural pathway in your brain, it is impossible for you to be pulled back permanently. Your new brain pathway does not die out unless you totally give up. Even if you have a setback, your new neural pathway is still there and will still continue to grow. You can save weeks and weeks and months of mental torture, though, by getting rational with this. This setback, as painful as it was, happened because of your two competing neural pathways. It is a totally normal experience that we all go through as we make progress. Here is a statement that fits the experience of having a setback. I turn my back on my old lying ways of thinking and deliberately choose the new positive direction I am moving. That anxiety response was a last-ditch attempt by anxiety to grab me back. I could actually say that my anxiety panicked. It is already scared it has lost me. Now, as I keep my thinking rational, I drive the dagger through the heart of that old neural pathway of anxiety. The best news is that when these type of setbacks begin occurring to you, you are definitely making progress. And when you don't respond to the old neural pathways, they will have no choice but to shrink to the place where they can't cause you the emotional pain and torment that they did in the past. These setbacks you have, and your response to them, are a sign that you're in the process of conquering social anxiety. So look at it rationally, and then congratulate yourself. As we learn to deal with social anxiety realistically, and deliberately choose to get back up on the horse again, deliberately refuse to wallow in the mud, and deliberately choose to continue on, we have taken another big step away from social anxiety and toward our new life. Interestingly enough, when an autopsy is performed on the person who is cursed,